Hi, I'm Sherry Harlan Davis, program host for Reid Beside You. Thank you for joining us, and today our guests are two new physicians to the Reid Health family, and they are both in our Reid Orthopedics area. And we have Dr. Braden Kirodowski and Dr. James Redshaw. So, and please also, I'm going to ask that you might hear me refer to Dr. Kirodowski as Dr. K. So make it a lot easier so I'm not stumbling over myself. Before we get started, we always like to find out how you came to Reid and a little bit about both of your background. So we're going to start with you, Dr. K.
Sure. So my connections to, the state of Indiana is I actually went to undergraduate college at Taylor University, so up in Upland, pretty close. But then I went to med school in the Chicago area, in the Chicago suburbs, and did family medicine residency in Chicago for 3 years. And then just recently completed a sports medicine fellowship, 1 year long, out in Billings, Montana. So kind of been all over, mostly in the Midwest. I was born and raised in Minnesota, but then, my wife has family in Chicago and Indianapolis. So we do have a kind of this connection to Indiana.
So great. And you, Dr. Redshaw?
Yeah, I'm originally from Pittsburgh, Pennsylvania. I came out to Indiana actually for undergrad as well. I was a chemistry major at the University of Notre Dame, and really loved my time out there. And then I went back to the East Coast up in Boston for med school, did my orthopedic surgery residency in Pittsburgh, back home, and then spent the last year in Philadelphia doing a sports medicine surgery fellowship over at Penn. And myself and my wife, we made our way back out here. We have some family in Indianapolis, but we really just love the small town feel and everything that Reid and even the city of Richmond had to offer. So we were excited to head out this way.
And we're very excited to have you both. And I know Dr. K has jumped in. He was part of one of our annual community events, Reid Ride. So we were real excited. He was one of our fastest bikers this year. So I'm not going to let you live that down. So,
Okay.
but we were really happy to have you. The sports medicine is a new addition into the Reid Ortho family. So could you tell us a little bit how that specialty is going to be working at Reid Ortho? And either one of them can jump in and.
Sure, I can start off that. Sports medicine, I think, is a term that can be a little bit confusing sometimes. Yes, Dr. Redshaw and I see athletes, high school, college, weekend warriors, stuff like that, and their injuries, obviously, to get them back to their sport. But I think, combined would take a look at musculoskeletal injuries or, injuries of your bones and muscles and tendons as something that we would want to fix so that you can get back to doing the things that you enjoy doing. And so in the past couple of years now, and maybe a little bit longer even, Reid Orthopedics hasn't had dedicated sports medicine specialists. Our orthopedic surgeons are phenomenal. Our PAs are phenomenal that work the walk-in clinic and assist with our orthopedic surgeons. But they're in a very focus of orthopedics, straight orthopedics with a lot of joint replacement surgeries and things like that. Whereas Dr. Redshaw and I are, I think, not that our orthopedic surgeons don't have the primary goal of getting you back to what you want to be doing, but I think they take a little bit longer time horizon on it, whereas we would say, okay, this sport or this activity is the thing that you want to be doing. What is the quickest and safest way to get you back to that? JT, you have anything to add on that?
Yeah, I mean, that sums it up, pretty well. I would say that myself and Dr. K, we are in the sports field, but one way to think about it is kind of like we always say, like active lifestyle medicine. And what we treat are the injuries, whether they're acute, all of the sudden injuries, or kind of chronic overuse injuries that stem from an active lifestyle. And that can be at any age, whether it's our high school athletes, college athletes, weekend warriors, or whether it's our day laborers and people who are just busy around the house as well. And so, like Dr. K was saying, we'll see all kinds of patients with all kinds of injuries, and that goal of getting everyone back to their desired level of activity, their desired level of function, that kind of is the main goal that kind of drives both of us.
We have a couple slides that are being shown. The first one on, what type of ailments are treated. And if you can, let's kind of go over this slide if we can. It's talking the ligament ruptures or osteoarthritis, calcific tendonitis, rotator cuff tears.
I mean, all of the above, really. If it is a musculoskeletal injury, then there's whether, like Dr. Redshaw was saying, whether acute, it happened, one moment you were fine and the next moment your knee was bothering you. We definitely treat that. We also, treat the, musculoskeletal issues that have come up over time and over many years. So one of those being, osteoarthritis. There's a lot of different modalities that we have and a lot of different options. And it is a kind of a case-by-case, patient-by-patient discussion as to what do we want to do as far as, or is it injections or procedures or surgeries or replacement to help a specific ailment. I know I saw another on that list, calcific tendonitis is common in the shoulder. It can happen in other places. In muscles and tendons, but happens frequently in your rotator cuff. And there's a whole continuum of things that we can do to alleviate that, or hopefully alleviate that aren't necessarily you need to get your rotator cuff repaired with surgery. There's other injections, other procedures that we can do. Sometimes, all those procedures may fail, and that's when we, Dr. Redshaw and I work as a team to try and get you back to what you want to be doing. Because if I come at something, an ailment like that from a non-operative standpoint, and we have tried everything that we can, and this is still not getting better, then we have Dr. Redshaw who knows the story and basically the history of what we've gone through, and can step in as the surgeon and get you back to doing those kind of things.
Yeah, and I think it's an important note too. I think a lot of people hear orthopedics, whether it's operative or non-operative, and they think it's only bones and joint replacements and things like that. But like the slide was illustrating, we treat a lot of, we do a lot of bony injuries, but also ligaments, tendons, cartilage, menisci, all those things, all those soft tissue structures that are important to living an active lifestyle. And so we see a broad range, kind of head to toe, bones, muscles, ligaments, almost everything.
One of the questions, and I had the pleasure of working with both of you at a community event, and it was a more senior audience. And one of the questions was with arthritis, and how do we work, and how do you work with people? Because often you hear arthritis, and they hear there's no cure. And I know that question came up, and you had some great answers. Can we review that?
Sure, yeah. Arthritis is a tough one. We don't have anything that can, or the medical community, despite what you may hear from people or right now, but right now we don't have anything that can completely reverse it and turn your cartilage back in, or turn your bone/cartilage interface in your joint back into, an 18-year-old knee. And so we have a continuum of treatments and procedures and at the end of that continuum is a joint replacement surgery, but we have this whole continuum that we can utilize to see if we can relieve your pain and symptoms. And that starts with, being active and staying active to promote good joint mechanics and biomechanics, and, goes up with, oral anti-inflammatories, sometimes topical anti-inflammatories. Sometimes the biomechanics of a patient's gait needs to be looked at. And so PT does have a small part to play in that maybe. And but then we go to injections, and there's multiple things we can inject. And then we get into kind of the procedures and more Dr. Redshaw's purview of, is this arthritis happening because the joint is inherently unstable and we need to stabilize it, surgically, or is the arthritis unfortunately so far been in existence for so long that the joint does need to be replaced? But I think there's a common misnomer that it's like, well, I either live with this arthritis or I get my knee replaced. And there's a lot of steps we can take before we have to make that final decision. And it's a conversation with the patient. So.
Right. And I agree with Dr. K. There are so many things that you can do prior to a joint replacement. And while joint replacements are good options for that kind of end stage of arthritis, they do very well in the right patients. I think it's fair to say that our goal, along with most patients' goals, would be to prolong the time until that joint replacement is needed, until it's absolutely kind of the end stage. And so a lot of our treatment options, whether it's non-surgical or surgical things, are kind of geared towards delaying that joint replacement, delaying that end stage of arthritis, whether it's treating symptoms, whether it's doing less invasive procedures that can stabilize joints, or maybe even hedge off the advancement of maybe a small area of arthritis that could progress to a larger one and more diffuse situation. And so we have a lot of options before that joint replacement to hopefully deal with arthritis before we get to that end stage.
That leads me to another slide. One, we're looking at active lifestyle and how that helps with the management of the specialized procedures and different warnings. So can we expound upon like ultrasound and biologics and how you two work together on those type of procedures?
I can start with this one. This is a little bit more of a non-operative slide. There will be some operative slides, I believe, later on. But as part of my sports medicine training that is non-operative, as opposed to Dr. Redshaw's sports medicine training that came at it from a surgical standpoint, I was taught and do a lot of ultrasound in procedure, especially for procedures as far as ultrasound guided needle injections. And then underneath that, especially with very expensive medications that we want to make sure get to the place that we want them to go, we would use the ultrasound to, visually see on my computer screen, the needle going exactly where it's supposed to go, so that we deliver these medications accurately. So biologics is kind of a catch-all term for a number of different things. And you may have heard of some of these things called hyaluronic acid or platelet-rich plasma. And those are generally the two biggest portions of the biologics pie, two biggest pieces of the biologics pie. There are some other ones like progenitor cells and adipose tissue and mesenchymal stem cells. But there has not been enough research that we feel confident using those types of products, not to mention that there can be some misnomers in definitions and terms that we don't have the confidence in doing those types of things in order to get you back to what you want to be doing. going back to the hyaluronic acid and the PRP, the platelet-rich plasma, we do have studies and a growing library of these studies that are being done by more and more centers across the United States and the world, that we can reliably use these injections to, get you back to functioning better.
The another slide we have is on just sports surgery and how you would work together as well. Dr. Redshaw?
Yes, and so my training, like we're saying, is in orthopedics surgery. And so kind of at the end of the line of a lot of ailments, but also kind of fairly on in some acute injuries where surgery is truly the only structural solution. There are a lot of things that we can do, whether it's through an open incision or even more minimally invasive using tiny arthroscopic cameras and small tools, kind of the size of the end of your pen even, to take care of a lot of issues, whether it's in the joints, tendons, muscles, ligaments. And so we're able to go in and do a lot of work with ligaments and tendons, whether it's fixing tears or reconstructing ligaments. We're able to do a lot of work with menisci, kind of trimming up torn edges or even repairing menisci in the right population. And one thing that hopefully I'll be able to bring new to the area will be a lot of cartilage restoration work. And it's interesting because it fits in along the spectrum of that osteoarthritis, but it'll be a procedure where we're able to address kind of smaller, more defined cartilage loss areas in the knee and treat those early with surgery, a smaller surgery than a joint replacement, and hopefully stave off the advancement of any arthritis and prevent that slow, long progression to a total joint replacement. And so those are all kind of exciting things.
And I want to highlight that these are because you both are bringing some new opportunities to our community. So previously, to get these type of services, they might have had to go out of the area. And it's exciting that these things can be handled right here within our community. So that's one of the biggest pluses. Now, on the other thing with the sports surgery, looking at, and as I like to say, and we were expressing that yesterday with our more senior audience, the active lifestyle injuries, and how even as we're trying to encourage people to get healthy, then some of these type of injuries happen. And how do you service those injuries? Or what do you see, like the chronic overuse, or maybe somebody gets so excited about trying to get back in shape they overdo it?
It's having that kind of balance, right? Yes, I'm excited. Maybe I've been a little bit busy with either my career or, kids or whatnot. And I've kind of let myself go a little bit, and you're like, okay, I can get back into exercising, but it's been a long time. And so you overdo it. But I think having someone that is trained more with the sports medicine aspect, as Dr. Redshaw and I have been, kind of positions us very ideally for kind of this, what we call with definitely our high school and college athletes, our return to play, and what that means, and how we can guide you back to doing that activity that you want to do because you want to lose weight because of the lifestyle benefits, the cardiopulmonary benefits. I mean, the exercising is probably the number one thing you can do that will benefit your health in so many different ways. And so we want you to do that. But obviously it can be frustrating when you get injured, 2 weeks into picking running back up, for example. So we are definitely there to kind of guide you back into that after you've had kind of an overuse, reuse kind of injury where, you know, you've overdone it as you've gotten back into doing it. And, you know, hopefully we can kind of pull back on the reins a little bit, but still keep you going in that right direction.
Also, the another area, and I know a lot of our area sports teams are very excited by having you in the area, and looking at just like our high school and college sports athletes, and how you plan to work with those people and integrating our medical sports trainers or our sports trainers in general. So how do you plan to work with them?
Yeah, so actually I have a printout of all their pictures right above the computer right now. And we, Dr. Redshaw and I work with all our area high schoolers, high school athletic trainers. And then currently we have 2 trainers at IU East, and we are working on getting a trainer at Earlham College to keep good communication lines between the college athletes and their coaches and their athletic directors, as well as the high school athletes and their coaches and their athletic directors. You know, Dr. Redshaw is doing surgery, and so he actually will be on call, I believe, you know, as an orthopedic surgeon, because that's how he's been trained. And obviously, you know, at the hospital, there are orthopedic emergencies that need surgery, and he is way more capable than I am to do that. And so my you know, my call in quotations is actually going out and being at games, whether they be, you know, high school or college football games, basketball games, stuff like that, to make sure that our athletes in the area are taken care of, and that trainers feel supported. But it's interesting. I have trainers texting me all the time about little things, and it's just good to have that communication there. You know, JT and I have talked about whether he's going to come to games, but it's also really difficult because there's a lot of high schools that we cover. So if you are the parent of a football player, do not expect that every week we will be at your son's football game or daughter's volleyball game or son or daughter's basketball game or something like that. But know that whatever high school or college they go to, their trainer has my cell phone number, will have Dr. Redshaw's cell phone, or already may have Dr. Redshaw's cell phone number, and they can get a hold of us if there's something that
and
needs
you
to be
have a
taken
big
care of.
area to cover with 6 counties in Indiana, 2 in Ohio, so, and that's a lot of schools. But we are so excited to have that addition with both of you covering those areas. What are some things I might have missed that you want to make sure people are aware of? What about you? I do want to remind people that we also have added a hand surgeon to the team. So if there's some other things about Reid Ortho and MSK as you start to grow, you might want to add on?
Yeah, I think the main things that we just would love to get across is obviously that how excited we are to be here. We both came here because we recognized how great of an opportunity this is, and kind of how much of a need there was for the things that we're interested in and the things that we do. And so we're excited to kind of hit the ground running here and take care of patients, whether it's with conservative measures ranging all the way to various surgeries, whatever they may need. And I think the main thing is that we're looking forward to taking care of the patients that might have had to go elsewhere, you know, prior to our arrival. And I think we're both just excited and kind of thrilled to bring some unique skill sets to the area and take care of the patients in their home area and do a great job.
Great. And Dr. Cave?
I would echo absolutely all of what Dr. Redshaw just said. You know, we both want to be here because we've got these new to Reid kind of things that we want to bring to, the athletes, whether they be 17 or 77, but they're athletes, and we want to bring those new techniques to the area to really help you live your most active lifestyle in a safe and healthy way, because we know that's healthy for you, especially in the long run. Specifically, I feel like I probably should bring up that I see concussions, especially in the high school and college realms, or with those athletes, that may be a little bit of a anxiety provoking, injury for parents and the patient themselves, and that concussions are this kind of gray box of, what do we go to the family doc or the pediatrician, or do we go to the ER? And just know that you have someone that, I've seen many concussions over the years, and we've got a good protocol in place that doesn't put you with an urgent care provider, though they are phenomenal. We also wouldn't want, with COVID out there, like going to urgent care for a concussion is probably not the best place for a patient with a concussion. But know that we've got a good protocol here to take care of those concussions. With obviously primarily we were focusing on making sure that brain does not continue to get injured and recovers effectively, but then also gets back to sport at the correct time. That's all I'll say about that, I guess.
Now, if someone was interested in making an appointment, they would contact Reid Orthopedics.
Yep, that's our general line.
And we have a slide.
Honestly, I don't even know it. It's probably a good thing. But we, Dr. Redshaw and I obviously are in clinic from the typical hours, Monday through Friday. Obviously, once his surgery schedule fills up a little bit more, there will be certain days where he won't be there. He'll be at the hospital doing surgery, but I will be here Monday through Friday. But then even if there's some acute
and
injury,
we're about to close, but we also want to make sure that people are aware of the Reid Ortho walk-in clinic. Mm-hmm. And then people can contact that number as well through looking at, if they call that Reid Ortho number, they can also get you to the walk-in clinic. But this went quick, and I want to thank both of you, Dr. Kay and Dr. Redshaw, for joining us today at Reid Beside You. Thank you.